Have you been injured, told that you have a disc herniation and you don't know what to do next? Don't worry, you're not alone. Hi, this is Dr. Matthew Collins. I'm a chiropractor. I am board certified in rehabilitation, fellowship trained in primary spine care. In addition to my education, training, and experience, we have been managing patients with disc herniation for several decades. What I'm about to show you is for educational purposes and information purposes only. It does not replace sound medical or chiropractic advice, diagnosis, self-care, or treatment. So this is part 3 of a 4-part series, and we're going to be discussing the role of chiropractors with disc herniations. Most patients with a disc herniation are somewhat scared to go to a chiropractor, and that's understandable. The thought of having some sort of force delivered to an already painful and injured area is alarming. However, the research shows that chiropractic care for disc herniations does produce really favorable outcomes. So I'm going to show you how we manage disc herniations in this office, and we do not do it in a very rough or aggressive manner. Let me show you. This table right here is our adjusting table that we use to adjust the spine when somebody has a disc herniation. So just to give you an example, this headpiece right here, it moves and it floats in the air. It can slide back and forth like that. The lower back piece here, it bends and flexes up and down. It has the ability to even elongate just like that. So what we have here, instead of having a human model, we have just a plastic model for demonstration purposes. So with the headpiece right here, we can put the patient face down. We can contact the portion of the spine that we want to work on and very gently work on that disc. We can open that disc space up, take pressure off of the nerve, move the joints around, and start getting some fluid to move through there. Same thing with the lower back. We can take the lower back, contact above the herniation, drop the table down, bend and move it. There's very clear directions that patients feel comfortable. We stay within the direction of comfort. That is one of the key treatment principles that we have to follow. It's called patient tolerance, patient preference. When we do that, patients respond well. In addition to this, it is not uncommon for patients to need co-management with other providers. Oftentimes referrals out for physical therapy, for home exercises when time is right can happen. Sometimes, in spite of doing the care the best that we know how, patients still need to have injections at the same time. And even if they don't recover well at all, they end up needing to see a surgeon. We coordinate that also. However, that's not always the case, but more oftentimes than not, patients can improve their disc herniation through chiropractic care, combination of self-care, home care, physical therapy referrals, and sometimes even medication. We help coordinate that all. We work in an integrated fashion with other medical providers in our community. So once again, this is educational purposes only. This does not replace sound medical advice. This does not replace a solid workup. So make sure that you get that if you have the diagnosis of a disc herniation. Thank you so much for spending time to watch this video. There are a lot of videos out there, and I'm honored that you chose this one. Until we meet again, thank you so much and have a wonderful day. Bye.